Hi, my name is Alexandra.
And my name is Sophia. So today we will talk about Huntington's disease. Did you guys know that actually the proper term is Huntington's chorea? When Huntington's was 8 years old, he was driving with his father when he saw two thin, tall women twisting and writhing from that disorder. That memory had such a big impact on him that he went on to study this disorder. The term chorea actually comes from the Greek word for to dance, which really characterizes the symptoms of this disorder.
So, what are the symptoms? The first symptoms are motor disabilities, which are characterized by dance-like but jerky and uncontrollable movements of the limbs and body, clumsiness, breathing problems, swallowing problems, and speaking problems.
There are also cognitive symptoms, including memory loss, difficulty concentrating, and some personality changes. And there are also emotional symptoms, including episodes of depression and mood swings.
So, how does one get Huntington's chorea? It is a genetically inherited disease caused by the Huntington gene on the 4th chromosome. If one parent has it, there is a 50% chance of passing it on to their children because the gene is dominant, meaning that if you have the gene, it will always become expressed. However, in Huntington's, this happens later on in life when you're about 30 to 40 years old.
Okay, so it's a genetic disorder, making it heritable, of course, but if you have the gene, then what actually happens, like what causes the symptoms? What actually happens is that once the gene, the Huntington's gene, becomes expressed, an area of the brain called the basal ganglia gradually deteriorates. This is a subcortical area of the brain, and it is critically important for movement.
Now that you know the severity of the symptoms, we strongly encourage you to get tested if you know someone in your family who shows such symptoms, and especially if you want to have children. It is relatively easy to check if you have the gene because the Huntington gene is easily detectable with genetic tests, and all you need to do is contact your GP. If someone is diagnosed, then they can get help to prolong and improve the quality of their life. The main therapies include physiotherapy for help with movement and balance, occupational therapy for help with practical tasks, and speech and language therapy for feeding and communication problems.
Also, another important thing you guys should take from this awareness video is that Huntington's chorea is different from the more well-known but also similar Parkinson's disease and Tourette syndrome. All of these symptoms of these disorders are sensory motor in nature, but with Huntington's, it typically leads to death 15 years after its onset, usually due to eventual respiratory failure. We would like to end this video by emphasizing that we need to reduce the stigma surrounding both mental and neurological diseases. It can really impact anyone. For example, the famous Glow actress from Netflix, Mariana Palka, is diagnosed with Huntington's chorea. And she even has an award-winning short HBO documentary called The Lion's Mouth Opens. We have put a link for the trailer in the description box if you'd like to watch it.
There are also a lot of myths around Huntington's disease, so if you want to check your knowledge, we have also put a link to a fun quiz. If you get any questions wrong, you get a nice explanation.
Thank you guys for watching.